Well, welcome, Lyn Delmastro Thomson.
Thank you for having me.
Oh, we're happy to have you here today. Tell us a little bit about what you do and what this idea of being a certified body talk expert is.
Sure. So body talk is a particular type of energy medicine, energy healing that looks at kind of understanding the story behind the symptoms. And so a lot of approaches, especially Western medicine, it's like, okay, you get a diagnosis and that's it. Like, it's not really, well, why did this happen? And we're much more curious at kind of the story behind it, because obviously things don't just happen for no reason. We don't get sick or have pain or, even just get a headache for no particular reason. It's intelligent communication from the body. And so really understanding that story behind the symptom helps us to heal when we see it in the light of day.
Right. And so what has you get into this kind of work? It sounds wonderful. It sounds almost like integrative medicine in some regard.
I think in some regard it is. Obviously it's different as well, because it's a different model, but it's much more holistic in that sense as well. I think that's where the commonality is. So I got into the work that I do. It was kind of a long journey there because I got really sick in my mid-20s. So I was in graduate school. I went to graduate school straight out of college. And I thought that I wanted to be a professor. And really, I think I was scared to just say, I'm going to go out and get a job. But then, so it felt less scary, after that many years of education. I loved school. And I went into graduate school, was miserable for, at this point, about 4 years before this happened, or 3 years. And I wasn't listening to that miserable, nature.
That's a long time to be miserable.
Yep. And so my body started to kind of talk to me in smaller ways with some depression and anxiety. And I started getting migraine headaches that I had gotten controlled in the past. And then finally, in the summer of 2004, when I was scheduled for elective surgery, I got a call from the surgeon the night before surgery saying, there's something abnormal with your blood work. We can't do the surgery. And at that point, I had like no outward symptoms of anything. It was just like this complete and total shock, because it was like, I thought I was fine. I was healthy. I was just choosing to have a breast reduction. And so I get that call from him. He says, it could be a lab error. Don't panic quite yet. Let's send you back. I rush over to the hospital that night. They run the labs again. I get a call, and it's the phone call you don't want to get, which is, nope, it wasn't a lab error. Something's wrong. And he didn't say much more than that, because obviously he was just a plastic surgeon. Like, he just knew what was safe for me to have surgery and what wasn't. And he wasn't going to say, this is what's going on. He just said, I suggest you go to your primary doctor as soon as you can. And I went down a rabbit hole for a couple of weeks of 2 different hospitals, multiple doctors, multiple specialists, to find out that they thought it was a type of leukemia. And of course, that news was shocking and scary and life-changing. And I lived with that diagnosis actually for 3 years before I found out that it was actually incorrect.
Oh my goodness.
Yes.
So did you go through chemo and do all of that?
Fortunately, I didn't have to go through chemo. The particular type of leukemia, they had a particular medication in pill form that wasn't chemo. I'm forever grateful for at least that small blessing that I didn't go through chemo, but it was basically like kind of chemo in a pill in a sense. So it had a lot of digestive side effects, just who knows the long-term implication of taking something that you didn't really need in the first place.
Right.
And not feeling well, because that wasn't resolving the underlying problem. There was a different condition going on with my health.
And what had you find out what exactly it was, and what was it?
So that was kind of a long journey through those 3 years. I kind of felt like there was something off after probably maybe the first year or so, was like I would go to the hematologist. He would, do all of his lab tests, and he would say, things look really good. And yet I was losing weight like crazy. Like people would come up to me and say, don't lose any more weight. And I was like, this is not like me going on a diet. This is my body literally wasting. And nobody seemed to pay a lot of attention to that. But I found it kind of odd, and I didn't have a good rapport with this doctor. He would spend just a few minutes with me. He would look at the lab tests. He would say, well, how are you feeling? And I would say, I feel horrible because I'm losing weight. I'm tired. I feel terrible. And he would say, which I consider to be a big lie, you look great. I'll see you in another month. And I was like, A, how is that an appropriate response to somebody who says, I don't feel well? You look great. And I was like, B, that's a lie. Like people are coming up to me and saying, you're turning into skin and bones. Like, don't lose weight. How could I possibly look great? It was just like, he didn't really care. He just looked at the lab tests and said, this is what you have. It looks treated, because they were looking at the wrong thing. And I kept asking for a referral to a different specialist, a different hematologist, and I wasn't getting one from my primary doctor because the two of them went to medical school together. And so he had a high opinion of him. Later, that particular doctor did apologize to me, and he's like, I can't believe this all happened. Like, I should have listened to you, which I wish he would have. And it was only 3 years later, as I kind of extricated myself from being in grad school, because at one point I had to stay in my program because I needed health insurance. I wasn't healthy enough to go out and get a job and get insurance. And yet when you have student health insurance, at that time, it wasn't considered creditable coverage. So the only way I could have insurance was staying in the system and kind of pretending that I was still working towards my PhD, even though at a certain point I wasn't. I was just kind of playing.
So tell us a little bit about how you were doing emotionally with all of this. I mean, first of all, when you found out, when you were wasting away and you knew something was up, and in those 3 years of taking this drug that you didn't even need, were they telling you that you had a certain amount of time to live, or that you would recover?
They weren't really saying I had a certain amount of time to live. I think, knowing leukemia, you kind of feel like there's a ticking clock, but I was never given a number. I certainly was dealing with a lot of depression and anxiety, and then that compounded the year after, when my best friend actually passed away very suddenly. And so I was kind of on shaky ground to begin with, going through this. And then when she passed, it was like my whole world just flipped upside down. And I went into a really, really dark depression. I became suicidal, but more suicidal by just wanting to let myself die by not taking care of myself. I wasn't going to actively kill myself. I was just more like, if I eat, maybe today I'll eat something. Maybe I'll take my medications. Maybe I won't. I just wanted to lay in bed and just disappear.
Yeah.
And it was kind of that was the tipping point, because I was in that dark space for, I would say, a couple months. And my parents kept saying, you're really depressed. We're concerned about you. You need help. And then finally, around Thanksgiving of 2005, that was when they convinced me to go into an inpatient program for about 5 days to get kind of stabilized and brought out of that really, really dark place that I had gone to.
Yeah. And then at this point, you still didn't have the correct diagnosis.
No. But that was kind of a tipping point for me, because I started to realize that I needed to do some work around my healing. Like, no matter whether a doctor would listen to me, whether that was what I really had. I started therapy several days a week to begin with. My therapist sent me to start a yoga class, which I was like, at first when she said go to yoga, I was like, I'm like skin and bones and exhausted. And like, I had a conception of, a preconception of what that looked like.
Right.
And she sent me to a class that was yoga for healing. And it was amazing. It was life-changing for me. And then I started biofeedback. I started acupuncture. I started just like exploring all of the different things that were out there for me.
And then how did you finally get the right diagnosis?
So in 2007, I left my grad program. I got a job. I got different health insurance, which was kind of like the key thing to unlock getting a different primary doctor who would refer me to a different specialist. And in that first meeting with the primary doctor, I said, I want a different hematologist. And she said, sure, here's a referral to somebody else. And I said, thank you. And I went to see that specialist and brought in, a stack of medical records, probably 2 or 3 inches thick from the past, couple years. He flipped through it in a few minutes and he started to question the diagnosis on that very day. He said, this does not look like what they think it, that this doesn't look like leukemia. I think it's something else.
Wow. So then you start a whole new journey.
Right. First, to figure out, okay, he didn't say he knew what it was. There was more testing, I think he was hesitant to say without testing to confirm. I think he probably had in mind the correct diagnosis, but of course he didn't want to. And I respect that. I respect being thorough before giving someone.
Well, given what you had just been through, I bet you had a little bit of leeriness.
Yeah, I think, there were so many emotions in that moment when he questioned the diagnosis. There was, relief that someone had listened to me, anger that nobody had listened for that long, that I had been trying to be heard for that time period, grief that at all I had been through, and, still a little bit of fear. Like, what is this? Are they going to figure it out correctly this time? What is it going to mean in terms of treatment?
Mm-hmm. Yeah. And so then how long after that did you actually come up with a diagnosis?
I think it was within a few weeks to a month. Like he did some more blood work. I had to actually have another bone marrow biopsy, which was the experience of those is nothing I would wish on my worst enemy. They're horrific. But ultimately it was needed. I knew it was needed to find out the correct diagnosis, and it was a different type of blood disorder.
And what was it?
Something called polycythemia vera, which most people probably have never heard of. It's just basically a disorder where we produce too many of all the different cell lines. So too many white cells, too many red cells, too many platelets. So my blood is like extra thick.
So what is it, a life-threatening condition, a chronic and progressive condition? What's the diagnosis mean?
It's definitely something, uncontrolled with really thick blood. You can certainly get clots in different areas. So it's definitely has the potential to be life-threatening. But for me, it's very well managed with one medication. And then I actually go for therapeutic phlebotomies. So I go in and it's basically the modern version of bloodletting. They take a bag of blood and they throw it away.
Wow. So all of that. So basically you're talking about almost 4 years before you started to really stabilize again.
And feel really like I was getting healthy, and then throw in the wrench in this time period of when I was actually transitioning to a new doctor. They actually found something was going on with my thyroid as well. So it was like another kind of speed bump in the road to feeling better for sure.
And so this, I'm guessing that this was the inspiration for you to then become a certified body talk practitioner.
Yes. Yeah. It was kind of a long road to get there because I actually started out with some other things that I studied and got a master's degree in a type of psychology that includes the body. And then I actually taught yoga for a while because I was very inspired by that work. And I studied biofeedback and worked with those tools. And then probably about, what is it now? I always lose track of how long it's been. About 7 years ago, I think, that I discovered Body Talk when I already had a practice. And I was just so amazed by this particular healing system. And I was like, had to learn it right away.
So tell us a little bit about what the system really is and how it's different from what we might know.
So one of the things that makes it unique is it really blends a lot of other healing systems into one. So the founder was an acupuncturist and a chiropractor and somebody who studied probably almost every healing system out there by this point. He's one of those people that's like perpetually learning and studying. And he's taken pieces of different systems and brought them into kind of integrate into one protocol chart, which is really, really cool because you can work with the meridian systems, you can work with Ayurvedic medicine in our protocol chart, but we also have a lot of kind of Western sciencey pieces. One of my teachers had worked in the Human Genome Project. She's a PhD researcher, turned into a body talk practitioner and instructor. So we work with things like how our genes are turning on and off. She works with a lot with hormones and neurotransmitters, which is really fascinating. And I think that's one of the beautiful things is just to have a system that's so comprehensive in terms of looking at the whole body and the whole energy system as well.
Yes, exactly. I mean, you can easily, especially I've studied Ayurveda, you can easily marry the Western and Eastern traditions. There's a place for all of it.
Exactly.
But how do you feel that the people who come to you, are they receptive, or are these the kind of people that are actually looking for someone like you?
Typically, people who come to see me are people who are already on that path of looking for something outside of just taking a pill, being in that model of like, this is just the way it is, and that's all I can do is just take a medication to symptom manage. A lot of people have tried other alternative approaches already, and they're maybe getting some results, but they're looking for more, or maybe they just haven't found the right approach.
Right. Now, so do you see mostly men or women or?
My practice is mostly women. I don't say no to seeing men, but my marketing is more towards women. I tend to find in general, women are kind of more along that path of alternative medicine, doing kind of deep spiritual healing work. But I have had some male clients as well. Sometimes it's like a husband too of somebody I've worked with, and then they come in through kind of that pathway.
Mm-hmm. And so do you deal with mostly people who are suffering from some kind of chronic illness, or just overall preventative, or both, or?
Both. I would say I definitely see a lot of people with chronic illness, especially a lot of autoimmune conditions. That's kind of just become a default specialty in a sense. Like I started noticing, wow, I'm just like attracting all these people with autoimmune, and getting really great results and seeing, them going off medications, their symptoms dramatically shifting in a positive way. But I also love to work more preventatively as well, because as I like to say, who wants to get that big, scary diagnosis? Who wants to have that life-changing wake-up call? If you could prevent yourself from getting to that point, wouldn't you want to do that? Some people, right. It's hard to prioritize that, but I love it when people realize, hey, I'm starting to neglect myself.
So do you think now, obviously you're healthier now than you were 4 years ago, but do you think if you had seen you as a practitioner when you were not feeling well, do you think your direction would be different? Would you be doing something differently?
I think I would have had more support to process a lot of things earlier on, because a lot of the work I do also works with clearing emotion, clearing trauma. And I certainly had a lot of that in the beginning. And that was certainly something no one talked about is, it's like, here's your diagnosis. Your life just changed. And okay, now we'll see you at a follow-up appointment instead of, we just changed your whole life. Like you might even want to go see a therapist at least,
So when you say that you are, you also work with trauma and other things like that, do you feel personally, just as a practitioner and the patients you've seen, do you feel like all of our chronic illnesses are being stirred up through traumatic events from our past or things like that?
Definitely. In fact, that was actually the subject of my podcast this week. I was talking about the connection between trauma and illness. I think most people who have chronic illness. If you look back at some point, whether it be birth trauma is one of the areas that can create illness actually, or a traumatic childhood, something later in life that was a big trauma. And then oftentimes we get the onset of something happening, a little bit after. I think that that's a key ingredient. I don't say, you have to have necessarily had trauma to have chronic illness, but I think there's a strong correlation for many people.
Well, and that's what happens in my practice as a spiritual mentor as well and meditation instructor, is I see a lot of unresolved trauma,
Yes,
which then results in a huge propensity for, conditioned kinds of behavior.
yes,
Just set them up for illness of some kind.
right,
Or like I said before, just the lack of support in their lives.
yes, yeah,
Even though in today's society, we seem much more receptive to going to see a counselor or somebody to help us out, it still seems like not a lot of us actually want to admit when we're really in a big hole
yes,
and we
yeah.
really need more help than perhaps the primary care physician can give.
Exactly. I think there's still a lot of stigma around certain things, even though, it is more acceptable to go see a therapist or to say, I'm depressed, I have anxiety, I'm dealing with, something with my mental health. There's still a lot of people that there's shame around that, that there's embarrassment. And I remember when, I was in that dark depression after my friend's death, at first I felt ashamed that I had to go into an inpatient program for 5 days. And now I share that freely because I don't see it as something shameful. And I want people to know that it's not something to be ashamed of. I mean, literally that saved my life, I think.
Oh, for sure. I mean, I'm in a graduate program right now for contemplative psychotherapy.
Mm-hmm.
And our biggest this year is based around compassion. And I think, to me, at least, that I'm only at the tip, very beginnings, but at least for me, it feels as though part of what's lacking is compassion. A
Yes.
compassion-based approach that says just what you said. It's okay to feel yucky. It's okay not to be okay mentally. It's okay to need emotional support.
Right.
That's part of the human condition.
Exactly. And there's so many reasons that can happen, that we can go into those emotional states and sometimes, we can get ourselves out of it and sometimes we need help and I, even lump in medication sometimes. I mean, when you're in the darkest of depressions, sometimes you need that help to just get you out of that low place.
Yeah, exactly. Now, who do you think inspired you the most on this journey? Is there someone in particular that just really fed you and kept you going? And
I think when I look back on it, and kind of the person that always wants to come to my mind is that yoga teacher at the Yoga for Healing class. Like, I think just the way that she held such beautiful space, like it opened the door to realizing that there were other things that I didn't know existed. Because for me, yoga at that point had been like seeing people do it at a gym and thinking, it was all the very physical postures, very exertive practice. And it was like, oh, we can lay on the floor and, put props under you and you can just like relax and breathe and do visualization and that can help you heal. And
yeah,
that was
giving ourselves permission to just be restored.
exactly. And just
Right.
have someone also just hold that space of, like she definitely was someone who holds just a beautiful healing energy. So to just be in her presence itself felt healing. And just to be in that container of the class, it was like, even though I wasn't per se doing a lot, I was laying there was a lot happening for me.
You were doing a lot, even in just the laying there, right? You're doing
Right.
a lot to just allow your physiology to just simmer down a smidge and just
Exactly.
be still. Because that's,
Exactly.
when I teach my meditation classes, brand new people sometimes when I lead into meditation will fall asleep. And
Mm-hmm.
I always say it's fine if you fall asleep during meditation, because all that means is that your body's trying to tell you that you need more rest.
Right.
When is another time during your day that you ever stop moving completely, have your eyes closed, but you're fully awake?
Exactly.
And we don't allow ourselves the permission to do that. Our lives are just way too busy, way
Yes.
too much.
Yeah. It was fascinating too when I was teaching more like restorative yoga, how some people, if they would come, they'd never experienced that before. And some people, you could feel how uncomfortable they were with just being still, and just laying there for 5 minutes in a particular posture. Like you could read the room, some people were like, oh, this feels so heavenly. And some people were like,
resisting
yes,
the rest, resisting the not the non-doingness,
exactly.
because and that's exactly, I think, part of what's causing so much anxiety. I see a lot of people with anxiety, depression, autoimmune, cancer, MS, adrenal fatigue. I have patients like that all the time, and I don't call them patients, clients, but I believe wholeheartedly it has a lot to do with the way our society runs, on this idea that if you're not doing anything, there must be something wrong.
Exactly. Where's your
That,
productivity?
yeah, that somehow it's not okay for you to take a break that isn't, a planned vacation.
Right. Yeah, it has to look a certain way, in order for that to be legitimate, instead of, hey, I'm exhausted today, I'm going to lay down and take a nap.
Yes, it's really, really important that we all listen to our bodies, just like your whole practice is around your body talking, right?
Mm-hmm.
Because it is all the time saying one thing or another, but are we listening?
Most of the times we aren't. We're just, oh, I got to get back to it. And I think that feeds into that whole culture of, even just over the counter medications. It's like, oh, I have a headache. I don't have time for this. I've got, a long to-do list. I'm just going to take, a Tylenol, an Advil, whatever, and just get back to it.
The quick fix for all of it, you can't Google health. You really can't. You
Right.
can't. And it's unfortunate, though, that we have sort of trained our society to be pretty mindless overall, and being in the mindful community myself. One of the homework assignments I give to my students is just start to pay attention to what you consume. And
Mm,
I don't mean what you eat necessarily. I mean
right.
what you're hearing, what you're listening to, what you're watching on TV, of
Right.
course, what you're eating as well. But are these things nourishing to us, or are they toxic to us?
Exactly.
And how many of us are walking through the kitchen, grabbing something quick, or going through a drive-through and not even paying attention to what we're putting into our bodies?
Right. Or eating while we're multitasking, like sitting at the computer or watching TV, and you're just eating and you don't even notice the food. I sometimes am guilty of it myself, and it's a habit that's easy to get into, of, doing
Yes.
two things at the same time.
Yeah. So the idea of mindful consumption in all areas,
Mm-hmm.
are you spending time outside in nature every single day?
Mm-hmm.
My prescription is minimum of 10 minutes a day in nature.
Beautiful.
And then I have clients that come back after a week and they say they never did it.
Hmm.
And it's mind boggling. But I think if we start to become more present to our own habitual ways of being, we'll
Mm-hmm.
notice there are little places where we can make tiny little subtle shifts that might actually make a huge difference.
Yes. Yeah. That's one of the things I always like to emphasize, is it doesn't have to be, changing your life completely, like going to a complete 180, but like little baby steps are so much more doable and realistic. It's like, okay, you get a couple baby steps and then, oh, those feel good. And then let's add a couple more, instead of, well, I'm going to just completely, change my diet and I'm going to exercise every day for an hour.
Well, that's that same all or nothing mindset,
Right.
right? That we're all kind of guilty of in some respects, is we forget that it's, you didn't get into the hole that you're in overnight.
Exactly.
They're not going to get out overnight. So just slow it down and be gentle with yourself. Find the compassion for yourself to truly take this journey and know that it's a lifetime thing. It's not a I was sick then and I'm well now.
Right.
I
Check.
need to,
Over and done.
I need to maintain my health and well-being, body, mind, and spirit every day of my life.
Right. Yep. There's no check and I'm done and on to the next thing. I mean, your health is lifelong.
Well, and I have that sort of sometimes with my clients who I teach meditation to, who think that, just coming to me once a week for community meditation is I'm going to somehow solve their problems. And, there has to be a serious mindset shift that suggests, look, none of this is something that you can just grab off the shelf, like you said, and you're finally cured. You actually have to put some effort into this process yourself.
Right.
Because I say, you can come and I'll teach you absolutely everything I know about meditation and all of that. And then if you leave and you never practice it, we just had a really great conversation and an awesome cup of tea.
Exactly.
And that's fine too. But I don't think that's what you want. I think you want more than that.
Right. Yeah. It takes work on people, the other person's side, the client side. And that's one of the things that I always emphasize as well. It's so easy for people to think, oh, you're going to fix me, or, I'm just going to come. I had a client who told me at one point that she was never going to do any of the homework that I gave her, that she just wanted to come lie on my table and have me, quote, fix her. And I was like, you're not a client for me. And I ultimately didn't keep working with her because I just don't believe in that approach. Like, yeah, I can make you feel good and I can support you in that hour that we're together. But if you're not going to even, some of the things I was asking her to do would take 1 or 2 minutes to do. And if you can't even invest 1 or 2 minutes in yourself several times a day, like that's a pretty big problem.
And I think if we back up and we look at that from a global perspective, it goes back to those two ideas that we haven't been taught that it's okay to treat ourselves with compassion and kindness. Yes. And we think everything can be Googled and fixed in an instant overnight.
Right.
And I think, for me, at least when I see clients, that's the first place I address is, first of all, you are whole and complete just as you are. Right now, you're in a rough patch and you're going through part of what life throws at you. And it's okay. First, you have to be okay and accept yourself for, I'm having a bump in the road. I need help. Mm-hmm. And then the other part is, I haven't been really living my best life, yes. My healthiest self. I haven't really been devoting a lot of attention to my health and well-being. Mm-hmm. And now it's time to make it through the door, which is yay, 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 right? They're here.
Yes, you're taking a step.
That's right. A lot of people don't even hear that.
Right.
Call to action.
Right.
But the ones that actually make it through the door, I'm always acknowledging them. Look, you got here. That's huge. Now you have to be willing to actually put into practice some of the shifts you want to make.
Right.
And can't just rely on me as a practitioner to do it for you.
No. And yet, some people, that's all they want is just somebody to make them feel good or somebody to go to. I've had people that want to just come in when they're in the state of crisis. And I'm like, I don't just work with you when you're in crisis. Like, this is a process. I don't just do kind of emergency healing work.
Well, that's the conversation that we want, you and I both, in what we do. Is that's the conversation we want to shift, that this is a preventative thing, not an emergent thing.
Right. Like, oh, I'm in a flare. Like, let me call you now. But, the flare's over. I don't want to do any of the work that could prevent me from going back into a flare.
Well, and for me, it's mostly people who are in emotional crisis that then is leading to the kinds of illnesses we were talking about earlier. But they can't identify with that. There's something underneath the illness that's causing the illness.
Yes.
enough to want, but they came to me. So I know they have an inkling, right? They have
Yes.
an inkling that there's something emotionally underneath this physical. And now it's just a matter of having them get over that other side.
Yes. Exactly.
Yeah. So what advice do you have for any of our listeners today?
Oh, there's so much that I could say. I think going back to this conversation we've been having, just remember that it takes time, that it's a process. Anything that's worth doing is really a process, and knowing that you don't have to make these big life changes is definitely a message that I want to reinforce. That, take your time, take your baby steps, and get there. Like, if you're climbing a huge mountain, you don't get to the top of the mountain in 3 steps. It's like you're taking a step and another step and another step, and you just keep going. And I think the other thing is just knowing if, you're dealing with something like chronic illness, shifting your mindset around that is huge, because Western medicine is going to want to tell you, well, this is all we can do for you, is give you a pill and you're going to have this forever. And I've seen people that's not the case. They've first eliminated a lot of symptoms, gotten off medications. And I have colleagues even who've there's no sign of the autoimmune in their body anymore.
Wow. Yeah, it's true. Mindset is huge.
But if you don't believe it's possible, then you're right there at that first block, right? You're at that block of like, how can it be possible if you don't even think it could be possible?
That's right. That's right. Well, it has been a delight to chat with you today, Lyn. I really appreciate your time.
I've really enjoyed it as well.
Yeah, and if you ever make your way to San Diego, come and visit us at Satsang House.
For sure, I will.
Yeah. Well, thank you so much.
It was my pleasure.
How can people find you?
So the best way to find me is my website, which is heartfirehealingllc.com. But I also post a lot of content on Facebook. My business name is Heartfire Healing, so you can find me there. And my podcast, if you like some of what I lay down here, is You Are Not Your Diagnosis. So you can look for that wherever you get your podcasts.
Perfect. Great. Well, thank you again.
My pleasure. Thank you.
All right. Take care.